Welcome to the Taiwan Language episode, a podcast for learning and insights in Mandarin and Taiwanese. I'm your host, Yasmin. In Taiwan, healthcare is really convenient. When you get sick, you don't necessarily need to go straight to a big hospital. You can first visit a nearby small clinic. These clinics are like mini healthcare stations in your neighborhood. And the best part is, many of them are covered by National Health Insurance, which helps keep your doctor visit cost low. There are two main types of clinics here. One is a general Western medicine clinic, and the other is a Chinese medicine clinic. You might be wondering, what's the difference between them? Let me share with you. At a Western medicine clinic, you will typically see a doctor who diagnoses based on visible symptoms. They will check things like pulse or use medical tools like x-rays, ultrasounds, or even blood tests to help with the diagnosis. The idea behind Western medicine is to treat the symptoms directly. For example, if you tell the doctor you have a headache, they will give you painkillers. And if you say your throat hurts, they might prescribe antibiotics or anti-inflammatory drugs. Western medicine is very much about quick, symptom-focused treatment. But if you visit a Chinese medicine clinic, things are a bit different. Chinese medicine takes a more holistic approach, looking at the whole body and treating it as a system. Special method called 望闻问切, which is how Chinese doctors assess your health. Wang means they will observe things like your complexion and tongue. Wen involves smelling things like body odors or bad breath. Wen means they will ask you a lot of detailed questions about your condition, such as if you've been having trouble sleeping or feeling extra tired. And Qie means they will take your pulse to assess your overall health. Because the diagnosis methods are different, the treatment plans are too. Western medicine often involves immediate treatment with medication. If you have a fever, the doctor may give you fever medicine. On the other hand, Chinese medicine focuses on bringing balance to your body. If you have a headache, a Chinese doctor might not give you medicine right away, but might instead recommend herbs to help balance your body. They might also suggest acupuncture or cupping to improve blood circulation. So the big question is, should you choose Western medicine or Chinese medicine when you are sick? It depends on your situation. If you are dealing with something urgent like a high fever or infection, Western medicine is your best bet because doctors can quickly treat it with some medications or injections. But for chronic issues like insomnia, digestive problems, or fatigue, many people turn to Chinese medicine because it helps adjust the body's balance over time. Take COVID-19 for example. Taiwan's approach combined both Western and Chinese medicine. At first, Western doctors gave antiviral medications to control the virus, but many people found that after recovering, they still feel really tired or had lingering symptoms like a cough. That's when they would visit Chinese medicine clinics to help boost their recovery. Some Chinese herbal treatments can improve your immune system and lung function, which is great for long-term recovery. So in summary, Western medicine is great for quickly addressing immediate health issues and treating specific symptoms, while Chinese medicine focuses on overall wealth and balance. In Taiwan, people don't just choose one or the other. They might even go to both types of doctors to get the best of both worlds. That's how healthcare works here in Taiwan. What about the healthcare options in your country? Which one would you pick? Feel free to share your thoughts with me in the comments. And then next, it's our Taiwanese time. We talk about Western medicine and traditional Chinese medicine. In Taiwanese Western medicine, it is 西医, 西医. And traditional Chinese medicine, it is 中医, 中医. And we talk about doctor. In Taiwanese, it is 医生, 医生. And headache, it is 頭痛, 頭痛. When you have a high fever, it is 發燒, 發燒. And now let's recap those 5 vocabulary words. 西醫, 中醫, 醫生, 頭痛, 發燒. Alright, that's all for today's episode. Thank you so much for listening to today's episode. I'd really love to hear your thoughts and comments. If you are enjoying this podcast, don't forget to hit the subscribe button so you will not miss any updates. In this podcast, you will hear about Taiwan's culture, history, and even a Taiwanese perspective on the world. Study Guide subscription can also help your language journey. If you find this interesting or helpful, I will be so grateful if you could share it with your friends and family. Please check out the show notes below for details about this episode and some useful links. If you would love to support this podcast, feel free to click those links or consider sponsoring. It really helps me keep making great content for you. Thank you again for tuning in. Have a good day, and I will see you in the next episode. Bye for now.